This segment of Afternoon Live is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Thanks for watching Afternoon Live. Improving heart health is possible at any age, and here to share about their Heart to Start program and how it has helped their patients, we welcome to the show from Providence Heart Clinic in Seaside, Dr. Robert Morse is with us. Dr. Morse, good to have you on the show.
Hey, thank you for having us.
Seaside is probably very busy right now, by the way, with this heat going on. I can only imagine the beach. But talking about this, the heart health, and sharing how you can improve it at any age so you can or cannot reverse heart disease.
Well, I'd like to say that that's our goal. I think realistically, what we're able to achieve at this time is slowing the progression. Cardiovascular disease is a lifelong disease process in America and in most developed countries. And the limiting factor for true reversal of cardiovascular disease has a lot to do with the social determinants of health. That remains a struggle: obesity, development of diabetes, access to smoking, access to health programs, access to primary care doctors and other levels of support. So I think realistically our goal is still slowing the progression. We have a lot of tools in our arsenal. And the key thing for prevention is to start sooner and earlier.
Can you share what your Heart to Start program is and how it's helping patients?
So the Heart to Start program was, we're coming into our 10th year. This was originally conceived by one of my partners and colleagues in Portland, Dr. Jamie Beckerman. And the beauty and success of the Heart to Start program is really in its simplicity. So the idea was to create time, space, and opportunity for people to come together, shared goal, shared endeavor, to whatever level of fitness that you were at, so that in the same group or cohort of people, you can have someone who's just starting out and going to walk their first 5K, and then you have other people who have other levels of fitness, and they may be trying to achieve their fastest 5 or 10K run, and that all of that spectrum is able to be completed within the same program. For now going into the 10th year is really fantastic, and it's basically a growing program that's just been tremendously successful.
What tips do you have for those who are older and have never exercised or not for a long time, so that they don't tax their heart when they jump back into it?
Well, I think the key thing, what I talk to with my patients, is to start slow and go low to an extent and gradually build up. So I think the simplest and easiest activity for most people to begin an exercise program is with walking. From a musculoskeletal standpoint and a cardiovascular standpoint, we were built to be moving and walking is just one of the easiest overall activities as your starting point to whatever else that you might want to do. You're going to be less likely to develop an injury. You're going to be less likely to become discouraged if you just start off, with a very simple activity first and then go from there.
We always hear listen to your body, but what are those signs? What should we be listening for if we're overdoing it, or if there is a problem that's going on inside of us?
Well, certainly the perceived level of exertion is what you're talking about or referring to, and that can vary tremendously with different levels of conditioning and the type of things that you do. So paying attention is simple things like when you are doing initially an activity, being able to carry on a conversation is a good sign that you're working within your current level of fitness and not overdoing it. If you're so short of breath that you can't speak or talk while you're doing whatever you're doing, it's probably time to dial it back a little bit. And this is something where participating with a partner or a friend can help with that, because you have to have somebody to talk to be able to do that aspect of it. So the signs that you may have a problem is that excessive shortness of breath, certainly chest pain, any of would be, sort of a danger sign that if you've not seen your doctor or talked to your doctor, you might want to go. I've had a few patients who came to see me as a cardiologist who started out wanting to be involved in an exercise program and then had concerning symptoms that they self-recognized, yeah, I better go get checked out. And we oftentimes do find out that they were experiencing a potential problem. So it's normal to feel short of breath, but it shouldn't be excessive, and certainly shouldn't be having chest pain or any of those other type of symptoms when you're, beginning an exercise program.
We're just about out of time, so I want to make sure that people know how they can get signed up and involved in your Heart to Start program.
So at this point, Heart to Start is just one of a series of programs that's all under our base camp that operates out of most of the Providence ministries with the Heart and Vascular Institute. So at base camp, there's a number of different health and wellness programs. Heart to Start is just one of those. The Heart to Start program this past year, because of COVID, was virtual, and the current plan for this calendar year, which will start probably same time frame around November to February, will probably be virtual again, with probably some opportunity for people to get together in small groups, but it just with that abundance of caution, not going back to full in-person participation in the Heart to Start program. So the website is hearttostart.org, and the base camp, I believe, is providencebasecamp.org.
We'll make sure to get people there as well. Dr. Morse, thank you so much.
Thank you.
And we'll get people to that information as well on our website, KATU.com. But don't go away. Afternoon Live, we'll be right back.